Hey everybody, welcome to this video where I'm going to be talking about the symptoms of endometriosis and when you should see your doctor. I'm Dr. Sylvia and this is Askawayhealth, the channel that gives you clarity and provides direction on medical problems. So let's get into it. Okay, so in this video we're going to be talking about the main symptoms of endometriosis. But listen, make sure you stick around until the end because I'm going to clue you in as to when the alarm bells should start ringing about your symptoms and therefore when you should be going to see your doctor. Now, just as a reminder, in the last video, we talked about what endometriosis is and we explained that it's a chronic medical condition. And what you have is that tissue, which would normally be within the inner lining of the womb, now appears in other parts of the body, for example, the ovaries or the fallopian tubes, or the outer part of the womb and within the abdominal cavity, etc. Okay, we also said that it's more common in women between the ages of 30 years and 40 years. And we made mention of the fact that it can severely impact a woman's lifestyle. So it's really important to be aware of this condition. The more common symptoms being heavy, painful menstrual periods. So let's dive in to what the main symptoms are. Firstly, there is pain within the lower part of the abdomen or the tummy. We call this pelvic pain. It can be worse, a lot worse, during a woman's menstrual periods, and the pain can also go around to the back to cause really bad back pain. Number two, severe period pain. So some women generally experience cramps at a moderate during the periods. But with endometriosis, you could have period pains that are particularly severe, even more so than usual. Another symptom is that there is pain that happens during or after sexual intercourse, and that could be a clue as to whether the symptoms are endometriosis. There is also pain when a woman is passing urine or opening her bowels during her menstrual periods. Another feature of endometriosis that can happen in some women is that they may experience difficulty when trying to have a baby, when trying to get pregnant. In addition to the other factors that can happen with endometriosis, is that a woman might find that she experiences chronic constipation, so really difficult to pass or open her bowels, which is relatively new compared to her usual pattern. She may also experience difficulty passing urine or notice that she has blood in the urine during her menstrual period. Some women complain of feeling very sick or vomiting during these episodes of their menstrual period if they have endometriosis. Another important consideration is the fact that because of the severe impact of the symptoms on a woman's lifestyle, the pain, heavy bleeding, it could disrupt the usual activities of work, studying, or even looking after your family. And some women get quite anxious and develop low mood. And so you can find that depression is an associated feature because of endometriosis. Right, let's look at when you should see your doctor. As soon as you've noticed a change in your menstrual pattern, it's important to talk to your doctor. Now, this could be anything from an increase in the length of your period, of the menstrual flow. It could be having pain that is different during your menstrual period. It could be having heavier blood loss during the menstrual period. It's important to maintain a menstrual diary, and we recommend this because this helps you to identify when things have changed and you can easily. So now we've covered the symptoms. When should you actually see your doctor? Now, as soon as you notice that there is a change to your regular menstrual pattern, that is a clue to when you need to talk to your doctor. This could be anything from a longer menstrual blood flow during your period. It could be to having more pain or worse pain than is usual for you during your menstrual period, or having heavier bleeding than is normal for you during your menstrual period. And we usually advise women to keep a menstrual diary because it helps you to remember when things have changed, and it's good to understand your menstrual pattern. Have a look at our video on understanding your menstrual cycle because this gives you a clue as to what happens, the changes during your menstrual period and what causes them. The other clue that will point you towards your doctor is if you've developed symptoms that are considerably impacting your usual activities. Really, it's not the time to endure this problem. It's best to get to your doctor as soon as possible because the quicker we're able to identify and diagnose, the quicker we can start treatment. So if you're undergoing more pain than usual, that's actually stopping you from getting into university or your classes or to work, or just being at home doing the things that you normally do, housework and so on and so forth, that is the time to be having a chat with your doctor. And also, if you've developed symptoms like I talked about before, chronic constipation that's different to your normal pattern and keeps going on, or you've developed problems like passing blood in the urine, these are reasons to speak to your doctor. Now you've been to your doctor, what are they going to do? So what you would expect is that your doctor will talk to you about a lot of the symptoms that you're having. They want to take a detailed account of your experience. So like, again, a good reason for you to keep a symptom diary. In the description below, I've included a link to a lovely document from Endometriosis UK. That's simply a well drawn out symptom diary. It helps you to record the changes that you've observed and how frequently they happen, which is easier and helps you to be able to present the information to your doctor without struggling to remember. Okay. The other thing that your doctor might want to do is carry out a physical examination, and this will involve examining your tummy and the lower abdomen. They might also want to carry out an intimate examination, having a look down below at the vagina and the neck of the womb, the cervix. So just in case this might happen, you might want to take a friend or a relative along with you, or if you haven't, don't forget to ask for a chaperone when you're being examined by your doctor. The third thing that your doctor would like to do during your consultation is arrange for some tests to work out what else may be responsible for your symptoms, because don't forget, heavy painful bleeding can also be caused by other problems, for example infections. So your doctor might want to do vaginal swabs or genital swabs, looking for samples that they'll send off to the lab to check for any form of infection. The other thing your doctor may want to do is arrange for you to have a scan, and that will be a scan of your abdomen and pelvis to look at the internal organs and work out if there's anything different about them. And lastly, your doctor will want to refer you to a specialist, the gynecologist, who specializes in looking after people with endometriosis, and you can discuss the treatment options further. Of course, this depends on the degree of endometriosis, and it's on a one-to-one basis. Every woman is different, and the symptoms can vary from one woman to the next. So that's a look at the symptoms of endometriosis and giving you a clue about when it's best to speak to your doctor. Okay, don't forget, the sooner you present to your doctor to talk about the symptoms, the earlier we can diagnose and start the right treatment. So that's a good point to remember. Thank you for watching today. Share this video if you've liked it and found it useful. Subscribe to our channel and click on the notification bell. The next video we're going to be publishing will be about the treatments of endometriosis, and I'm going to give you a clue about how you can decide which option will best suit your person when you're making a decision about what treatment options to take up for managing endometriosis. So don't forget, we publish our videos usually once a week on Wednesdays, and if you have any questions on this topic, then feel free to send a message. I'm going to put the link to all our contacts in the description segment below. So take care, have a good day. I'm Dr. Sylvia, and this is Askawayhealth, the channel where you get clarity and directions about medical problems.